Okay, guys, let's talk about our last category of the NCLEX test plan, and that is Psychosocial Integrity. Like the section on health promotion and maintenance, the Psychosocial Integrity category constitutes approximately 12% of the NCLEX questions. Questions in this category pertain to patients with psychiatric problems and their unique issues. In addition, this material may cover coping mechanisms for different situations. That's very important, you know, because in today's society, where we have post 9/11, where we have unemployment, where we have economic distress, there's a lot of people self-medicating and self-coping, alright? And they don't have the coping skills. So that's why you see a lot of alcohol abuse, street drugs, herbs. Okay, so know your herbs for the NCLEX. A lot of people think that, like hops valerian, okay, which is a natural anti-anxiety, all right, Valium, right? Hops is the same thing that substance that's found in beer, right? So hops valerian you could buy at the health food store. It's supposed to be a natural relaxant. Okay, people don't realize that that can have the same effect as alcohol or the same effect as Valium if you take it in too large of batches. There's a lot of street drugs on the street, of course: cocaine, marijuana, alcohol, and that's because of the society we live in, ladies and gentlemen. You know, we're every country's at war, every state is finding it hard to employ people, Homeland Security, post 9/11, all of that makes it very, very difficult to live in life. So this is a very important category for the NCLEX. I know we don't focus on it enough in nursing school. Of course, I'll say a little bit about it with the tutoring, as it needs to be said, because it is on the NCLEX, but I'm just trying to explain why it's on the NCLEX. Alright? So, other situations covered in this section are about psychosocial problems that fall short of psychiatric illness. Questions could cover information on the following disorder: depression, lots of depression these days, right? Schizophrenia, organic mental disorders, eating disorders, personality disorders, and anxiety disorders. Also included in this section may be questions about crisis intervention, substance abuse, and therapy through communication. Such contents would include, but like I've always said, not inclusive to, abuse, neglect, family dynamics, behavioral interventions, grief and loss. By the way, you know, a little pet peeve of mine with this grief and loss, a lot of people talk about the 5 stages of grieving, right? What are they? What are they? Denial, anger, bargaining, depression, and acceptance. What's my pet peeve about it? Because when people usually talk about the 5 stages of grieving and what they are, they don't mention the therapist that was behind that. And she was a very, very wonderful lady. She's very, very instrumental in working with hospice patients. She's written a lot of books, and she wrote a book while she was dying. And her name is Helen Kubler-Ross. So if you're going to talk about the 5 stages of grieving, mention her name, Helen Kubler-Ross. Alright? I see a lot of people not mentioning her name. I've actually met this individual in person, and she has passed away, but she was a wonderful lady. So give credit where credit is due. Helen Kubler-Ross, 5 stages of grieving. Not just 5 stages of grieving. But this is a topic for another day. I'm digressing, am I not? So let's continue. So contents that would be included in this topic would be chemical and other dependencies. That's why it's important to know your herbs, ladies and gentlemen. Substance use disorders, mental health concepts, religious and spiritual influences on health. You wouldn't think the NCLEX would go there, but we have to go. Well, I'm not part of the NCLEX. I'm not a writer. I don't work for the government. I don't work for the National Council Board of Nursing. Nothing. But we have to go there with religious and spiritual influence on health, because America is a melting pot. We have every religion in the United States, and it's important that we respect every single one of those religions, or spiritual beliefs, or beliefs in general. That's what America was founded on. Do we have to agree with them? Of course not. Do we have to respect them? Absolutely. This is America. Freedom of religion, freedom of speech. Another topic for another day. Okay. Coping mechanisms. Sensory perceptual alterations. Sensory system in the 9 System Review if you purchase it. Crisis intervention. Again, all of these things, the psychosocial things, they have 3 categories. And it's Psych Mental Health Part 1, Psych Mental Health Part 2, Psych Mental Health Part 3. You can purchase them separately on my website under 9 System Review. Okay? Stress management. Stress management. Cultural awareness, cultural influences. Those are hard questions. I go over them in a little bit of detail when I tutor. A lot of times when I ask those questions and go over those questions, you don't understand the question, so I have to explain that a little better. So I will explain it better. I love my job that I do on the internet, and I would definitely take my time, hold your hand, and walk you through the process. Again, when I tutor you, you guys can ask me questions at any time during the tutoring session. You don't have to hold all your questions till the end, because if you do that, you're going to forget your question. I mean, we need some continuity, we need some order, but you can ask me a question anytime that question comes to mind. You don't have to wait till the end, because if you do that, you're going to forget it, and then what's the point of the tutoring session, right? Therapeutic communication, big one. It's also on my 8 essential concepts of the NCLEX, okay? End-of-life care. Okay, this would be considered hospice, ladies and gentlemen. Nothing is on the NCLEX that is not national or part of its territories, the United States territories, right? So if and when the NCLEX talks about hospice, the same holds true in every state. Not just New Jersey, not just New York, not just California, not just Florida. When the NCLEX asks you a question about hospice, it's got to be true in every single state. Alright, because the NCLEX is a national exam. So if it's different in your state, it's not going to be on the NCLEX. Whatever the question's asking. Or whatever you may come upon. Whatever you may come upon when you're tutoring. When you're studying, because a lot of you do self-studying, okay? And you got to realize that the NCLEX is a national exam. So if something is true in Florida, but not true in New York, for example, it won't be on the NCLEX. The NCLEX is a national exam. And then also in this category, we talk about therapeutic environment. So for those of you who are struggling with psychosocial integrity, you can buy Psych Mental Health Part 1, 2, and 3 on my 9 System Review page. That's what I call it. I also call it core nursing, basic nursing, your college, you know it as HESI or ATI. Alright? HESI and ATI is core nursing. I don't consider them to help you with the expert questions. So, I've made my opinion known about HESI and ATI. Let me tell you something. I get a lot of email that says, hey, I graduated top of my class, and I took the ATI, and it said that I had a 95% of passing the NCLEX, and I failed. I don't understand why I failed. Because, in my opinion, the ATI and the HESI is core nursing. Now, you need the core nursing, and some reviews are very good on that, core nursing, right? But I really focus on those expert questions, those high level. You're not going to pass the NCLEX if you don't get 50% of the expert questions correct. So this is what I like to concentrate on, right? So it's not your fault if you failed the NCLEX, even though you got a high ATI or high HESI score. That's core nursing. You have to understand the 8 essential concepts of the NCLEX and perhaps do some tutoring with me to understand the expert questions. Something that nurses that have been nurses for a while would know. The reason you only have to get 50% correct is because the NCLEX knows that you're a novice nurse. What do I mean by novice? The NCLEX knows that you're a graduate nurse, that you have not gotten your feet wet, that you don't know how to swim. So that's why they only want you to get 50% of the expert questions correct. You see? And who helps you with that? Someone like me. So again, in closing, like I did with all of my other presentations about the NCLEX test plan, I'm going to tell you the current content area client test plan. Current now and current in the future. So if you see this video a year now, 2 years from now, 3 years from now, it's going to be the same because I'm not putting up specific numbers. If you want specific test plans, like I said in my other videos, go to my website, caringforyou.net. Click on the RN. If you're the RN, it'll be down the middle of the page on the right-hand side. That'll be your current test plan. For the LPN, click on LPN at the top of the site. Go to your LPN page. Down the middle of the page on the right-hand side will be the current LPN test plan. I'm not putting up specific numbers, so don't email me and say, hey, is this video still correct? The answer will be yes. Okay? Because for specifics, you need to go to my website. That'll always be updated there. Right? So in closing, management of care has increased by 1%. Safety and infection control has increased by 1%. Health promotion and maintenance has stayed the same. Psychosocial integrity has stayed the same. Basic care and comfort has stayed the same. Pharmacological and parenteral therapies has decreased by 1%, but don't let that fool you because there's a lot of pharmacology on the NCLEX, alright? And that's why I'm working on a series, but that's slow going because I don't know the pharmacology any more than you or the next person. And furthermore, it's really not my favorite topic. But I am working on that, so I appreciate your comments on the pharmacology ones that I'm doing. And yes, I will get to all of them. I'm going to have 10, I think, and so far there's 2. So Garrison better get to work on that, huh? Alright. So, reduction of risk potential has decreased by 1%, and physiological adaptation has stayed the same. So, this brings me to the end of the NCLEX test plan explained in plain English. So, good luck, you guys. If anyone needs anything, you know where to find me, and you know that I'm very attentive and responsive to all your emails, all of your comments, and thank you very much for making my site a better site to help future nurses that come after you. So I really want to thank you guys because what you see on my site is a culmination of 16 years of helping people with the, or is it 17? Since 1997, helping people with the NCLEX. But I wouldn't have all this insight if it wasn't for you, ladies and gentlemen, sharing your information. Not questions. We never share questions. We only share topics. Sharing your experiences. All that's good. That's going to help all the nurses that come after us. Yeah. So thank you very much, guys, and I will see you soon in the email, on the phone, on the YouTube comments, wherever you want to get in touch with me. All right. Have a good one.